countrymen, countrywomen, and foreign residents of Uganda. I've come back the third time to talk to you about the Ebola outbreak that we have in the districts of Mubende, Kyejegwa, Kassanda, Kagadi, and Bunyangabo. We now have a total of 58 confirmed cases and 19 deaths. It's a bad disease. It's very violent once it gets in your body, but actually it is very easy to avoid. But, nantabuulirwa yasabalana bwa bumba abaganda bwetu bwe tugamba. The one who cannot be advised was told don't use a clay boat. Clay doesn't make boats. And for him he said, no, I'm very clever. I can make a boat out of clay, and he ended up in the lake. Abo abaganda bwe twagira olugero olugamba nti nantabuulirwa yasabalana bwa bumba. So, bano banantabuulirwa, these ones who cannot be advised. Last time I spoke to you about some people that were difficult, lying to us, balimba, hijacking dead bodies. Imagine, hijacking dead bodies. Our government bagenda kuziika mu ngeri etagenda okusasanya obulwadde bo ne babanyagako omulambo. And moving from district to district, including coming to Kampala, here in the city. This movement and deceit has not changed, and the risk of spreading Ebola to other parts of the country remains very high. So now, movements into and out of Mubende prohibited. Togezanga kufuruma okuva mu district ye Mubende oba okuyingira. If you are in Mubende, stay there now. Don't move. Out of. And if you want to go to Mubende, don't move into. Okay? That's number one now. Number two, movement from Kassanda to Mubende and vice versa is prohibited. So, within, mwena tubasibya Mubende ne Kassanda tubasibiddeeyo. Tewoba ayingira, tewoba afuruma. But also, within that area, Mubende Kassanda, nobody should move from Kassanda to Mubende or from Mubende to Kassanda. There will be curfew in Mubende and Kassanda districts starting from 7 p.m. sawa muyekiro up to sawa 12 z'ekiro. Number four, movement of persons within their respective districts is allowed. That's what I was saying. Movement emisana during the day, not in the night. In your district, you can move. That means you move within Mubende if you are a Mubende East. You move within Kassanda if you are a Kassanda East. but not between Kassanda and Mubende and Kassanda. Number 5, public transport, private transport, and borders are not permitted to move in Mubende district, in Kassanda district. Buses, Bukamunye, the Kamunyes, taxis, borders don't move. Those vehicles of the government which are allowed to move, because they are vehicles of health workers or security or other vital government services, will not transport people. They just transport the officers involved. And then even the cargo vehicles should not attempt to take people. The security forces who are enforcing this, I will demand that they are given cameras, they are given either phones which can record, so that when they are impounding the vehicle, they record the scene, so that we have proof that somebody was carrying people, was breaking the law in this way. Now, because of Mubende and Kassanda being at the heart of Uganda, we don't want to block our people from Fort Portal and from Kagadi and from Hoima. So we come to number 7 now. And that's why we talk of transit vehicles, public and private, crossing through Mubende and Kassanda districts are permitted to move, but with police clearance, and shall not stop to pick or drop people. 8, cargo trucks with only a driver and 1 turnboy shall be allowed to deliver goods and may carry goods out of the district, but shall not carry passengers. Number 9, all cargo shall be delivered to the districts of Mubende and Kassanda during the day. Ebyekiro tebiriwo. Cargo vehicles shall be required to leave by 5 p.m. and the operators will not sleep in any of the 2 districts. You come, drop, and go away by 5. Don't sleep there. Anyone who sleeps in the district shall remain there for 21 days.
The cargo trucks that bring goods into Mubende
Can take them out.
can take cargo out.
Very good. But operated by the non-Mubendis,
Not non-Mubendis.
non-Mubendis, non-Kassandis.
Yes, Excellency.
All seasonal markets of Butaro Bumuburo are suspended in the Kassanda Mubende district. Eyo number 10. 11. The mines in Mubende will remain open for people in Mubende, and the mines in Kassanda will remain open for the people in Kassanda. No crossing over. In addition, daily temperature checks, hand washing, and symptom screening must be enforced by the proprietors, the owners of the mines. Number 12, schools should remain open, and learners should be allowed to move when in school uniform. Allowed to move when in school uniform, so that we know that you are a student. Temperature of all the learners, teachers, and non-teaching staff should be monitored on a daily basis. 13, any school absence must be reported immediately to the health, what my daughter Acheng calls response teams. People will not know that. They mean the health people. When any child misses school, the head teacher inform the health officials nearest to him, either Health Center 3 or the district. Number 14, all children, teachers, and non-teaching staff who have had contacts with the person who has signs or symptoms of Ebola should not go to school. Oyasigara waka. All places of worship are closed, should be closed. Ate tumungamba nti Katonda ali mu kizimbe kubanga luli ekyo nakyo twakikayanako waliwo bagamba nti Katonda nti ali mu kizimbe wokka. All bars amabaara gonna, places of entertainment, bibanda, bidandari, gyms and saunas in Mubende and Kassanda district would be closed. Number 17, all burials, whether Ebola or not, shall be conducted by the health burial team during this period. Samples will be taken from all dead bodies and tested for Ebola. Buli muntu yena anafa temumuziika ate temumukwatako until the health people have come, whether you think it is Ebola or not, because for you can't know from guessing. Government should intensify public health awareness after further understanding community issues, culture, and traditions. 19. Ministry 19, Ministry of Health must intensify surveillance and contact tracing in the 2 districts, speak out all the possible cases. Enforce hand washing, sanitizing, using alcohol, hand rub in both districts. These are in the offices, but in the homes, I think people can use soap. Minister of Health will secure and deploy 20 ambulances from various districts and regional referral hospitals to the 2 districts for continuity of essential health services. So they will get from all other districts and reinforce you. The Minister of Health will mobilize and deploy 10 vans to transport health workers in the 2 districts. Health workers with the vehicles shall be given permits by the RDCs to move only within their districts. 24, Minister of Health will provide PPPEs. These are the clothing to wear, the protected clothing to all registered health facilities, private and public, countrymen, countrywomen, and foreign residents. These are temporary measures to control the spread of Ebola, but caused by Nantawurira. They are unadvisable. They are the ones who have caused this. Because this was very easy to stop if the people of the other village had listened. Countrymen and countrywomen and foreign residents, these are temporary measures to control the spread of Ebola. We should all cooperate with the authorities so that we bring this outbreak to an end in the shortest possible time. In regards to the essential health services, ambulances, vans, and medicines have been deployed to support continuity of other health services. Those who are sick should use the ambulances to access the hospitals, and health workers should use the vans.